warm welcome to thorough newspaper analysis, which is presented to you by Lawsico. So today we'll discuss important articles from the newspaper of 15th May 2021. This newspaper analysis is presented to you by me. My name is Ankita Parida. I have completed my BTech from IIIT Bhubaneswar and MTech from ITR, and I have completed my LLB in 2020 from Fakir Mohon University. And presently, I work as a trainee associate with Lawsico as a current affair expert. You can reach out to me at my LinkedIn or Twitter handle, which is mentioned here. So today we have three important articles of the day. The first is titled as In COVID Storm, the Key Principle Driven Home. In this article, it talks about principles needed to be followed to manage COVID in a better way in India. The second article is titled as Lend a Helping Hand to Children the Right Way. This article talks about the crisis of orphan children in this pandemic and how to go about adoption and childcare. The third article is titled as When Doctors Fall Short. This article talks about issue of shortage of doctors during COVID crisis and how it can be optimized. Lastly, we have some item in the news and flash section. So moving to our MCQ section, which provision of Epidemics Disease Act exempts suit against any person or anything done in good faith? Your options are Option A, Section 6, Option B, Section 3, Option C, Section 4, and Option D, none of the above. You can write your answers in the comment section. The descriptive question for the day is, the pandemic demands acceleration of restructuring of primary care, critically analyze. You can write your answers in 250 to 300 words. So moving to our first article of the day, it talks about first principle for COVID-19. In this, it has denoted the traumatic fallouts of pandemic in India. And in this, the author talks about 5 key principles by which one can mitigate the traumatic fallouts of pandemic. So moving toward the key principle, the first is about the universal health care. Regarding this, the author has given example of the UK government model in which everybody is covered under the universal health coverage. In India, though we have a universal health insurance, that is Ayushman Bharat, however, we do not have a strengthened public facility in which the people can go and avail this insurance facility. So today it is the time that we should focus on strengthening public facilities, and we can see its effectiveness in Kerala, in which they have a very strong network of public facilities, and also the paramedics and medics are very well organized, because of which Kerala has a very robust medical system. Secondly, India needs to focus on scientific outlook without going into irrational debates on the past and mythological things. So to enhance the scientific outlooks in people, as well as to increase the investment in scientific research, India needs to bring more public allocation of funds and increase its spending in scientific researches. Thirdly, there is no public expert or epidemiologist yet in the crisis of pandemic to suggest us very well in the crisis situation. And based on it, India needs to appoint one or more public health expert to mitigate these factors. Thirdly, we have seen that in India, there is a great level of data hesitancy. Previously, it has been seen in economic data, employment statistics, changing baselines, and withholding public periodic labor force surveys. However, this has also precluded to the data of COVID-19 crisis. And based on it, mortality rates are in India are many times lower, and what is happening officially. So it is time that we should give importance to good economics, and it is time that we should also think about universal income in India, because This pandemic has shown that people are going out of job and do not have money for their living. So therefore, without giving more freebies to enhance their political popularity, rather we should focus on universal income today. Moving to our second article of the day, it talks about care and protection of orphan children. In this article, the author has talked about the children who have left orphaned and vulnerable because of the second wave of COVID 19. And we see today that social media is flooded with requests to adopt children, and even many people have adopted children without going through the legal procedures. So, it is very important to know about the legal procedures which are involved to address the situation of adoption of a child in this kind of circumstances. So there are many established procedures. First is to call a child helpline number 1098, which is managed by Women and Child Development Department. Secondly, one can intimate the district protection officer, which is present in every police station in every district. Thirdly, one can approach to the nearest police station or its child welfare police officer who is specifically trained to exclusively deal with the child or the victim. So, based on these reports, it is the duty of the outreach agency to produce the child within 24 hours before the Children Welfare Committee. And based on the inquiry and scrutiny, CWC, after inquiry, sends the child to a child home or a fit facility or a specialized adoption agency. The court has also given many directives regarding it. The Supreme Court in the Bachpan Bachao Andolan versus Union of India case had directed all Director Generals of Police to register an affair as a case of trafficking or abduction in every case of a missing child. Secondly, at least one police officer not below the rank of Assistant Sub Inspector of Police um, is in each police station is required to undergo training to deal with these kind of children. Also, in another case, that is exploitation of children in orphanages in the state of Tamil Nadu in 2017, the Supreme Court had given its directive and had asked the National Police Academy Hyderabad and Police Training Academy in state to prepare training on juvenile justice. So based on this, Juvenile Justice Act has also provided the norms and practices based on which one can adopt in a very less cumbersome way, and one can try to adopt a child based on Juvenile Justice Act and go ahead with the adoption. The third article talks about the shortage of doctors in this pandemic and how it can be addressed. So today we see there is a huge shortage of doctors in our public health system, and even we have seen that many doctors are not willing to join the public health network because we have a very poor infrastructure, and the incentives of the professionals and the growth have many bottlenecks. Secondly, there are lack of basic amenities like toilets and water facilities. There is insecurity and disgraceful behavior in the public health system also. Today, the girls are not joining the mainstream healthcare network of the country because of these various reasons. It is so abysmally low that in the allopathic network, we have one female for 10,000 people, which is like 0.5% in the rural area and 6% in the urban areas. Though we see that more than 55% are there in the graduate level, and in the NET UG admissions, there are more than 55% of female. However, in the mainstream health network, females are not willing to join the mainstream medical system. Because of this, there is a huge shortage, and also we have seen this in this pandemic that many medical professionals and the paramedics have lost their life, and now it is time that we should do optimum uses of the doctors. The doctors are the specialized person who are there for specialized diseases, specialized problems of the patients. However, the staff and the paramedics and the nurses can take care of the primary things which a patient goes through. So in this situation of pandemic, these paramedic and the assistants and the nurses need to be more trained so that they can take care of the patients to a better level. Also, we need to increase our primary healthcare network in the country by reaching out to each unit in the district. Also, there is a need to develop the telemedicine web portal today, because we cannot reach out to the doctor because of this COVID situation, and therefore one can reach out to the doctor only through a web portal. And this can be done effectively if the pharmacies in the villages and the pharmacists in the villages are very well trained with the um, telemedicine portal. And a telemedicine kit is also should also be provided to them, so that he or she can pass on the vitals of the patient to the doctors. Also, in this article, the author suggests that the retired doctor should be brought to mainstream, so that they can be useful in training the new doctors and give guidance to them. This has been seen in the armed forces, in which the doctors who have retired just 2 years back have been asked to resume duty. They can also join in the nearby areas and join the mainstream in this pandemic to help the people in large. Also, one thing can be done, that the people of other specialization like the dermatology, neurology, or cardiac specialist can be trained in respiratory diseases, so that they can with a very little training, can help in this kind of pandemic situation, which is mostly related to the respiratory diseases. So these steps can be taken to optimize the uses of doctor and remedify this shortage of doctors during this pandemic in India. Lastly, we have a news item in flash. Cyclone TAUKTAE is likely to intensify into a severe cyclonic storm within 6 hours, and it may hit Gujarat coast by Tuesday. The cyclone is likely to cause rain of varying intensity in the parts of Tamil Nadu and also in Rajasthan. This is the first cyclonic storm in this year in India. So this was all for today. Thank you.